Intestinal bowel ultrasound is a non-invasive imaging technique used to view and evaluate the intestine and surrounding structures. Just like an obstetrician uses ultrasound to monitor a fetus, intestinal bowel ultrasound uses high-energy sound waves through a handheld device called a transducer. These high-energy sound waves bounce off internal structures that then generate images. So intestinal ultrasound, again, is a non-invasive imaging evaluation, and it is particularly helpful in managing and monitoring patients with inflammatory bowel disease. Inflammatory bowel disease consists of both Crohn's disease and ulcerative colitis, and may have complications such as strictures or fistulas, and intestinal ultrasound is something that would be able to detect such complications. A stricture is a narrowing in a segment of the bowel that can cause obstruction or downstream complications. And a fistula is where you have portions of the bowel that may connect to each other or connect to other structures within the abdominal cavity or pelvic cavity. In terms of management, oftentimes intestinal ultrasound can actually detect inflammation that patients may not even feel. And this finding this inflammation early can potentially prevent long-term complications from inflammatory bowel disease. When patients come to scheduled clinic appointments, this test can be done within 10 to 30 minutes during their follow-up visits or even their initial visit. And it can help the clinician as well as the patient see the inflammation or lack of inflammation in their bowel and can help adjust or modify treatments that they're currently on. So intestinal ultrasound has many benefits. First, it is safe and non-invasive. There is no radiation associated with intestinal ultrasound, much like some other imaging modalities often used to monitor patients with inflammatory bowel disease, and it is non-invasive, so there is no need for anesthesia or sedation or even preparation. In terms of therapy modifications, patients are able to get real-time images and able to make treatment decisions with their provider. They're both looking at the same ultrasound screen. They're able to see what the segments of their bowel look like. Providers can point out segments that may have inflammation and why they may want to change therapy. So it does improve patient understanding and provides real-time imaging for patients. In addition, many patients find that it is very simple and comfortable for them to do an intestinal bowel ultrasound. And again, it can be done during an office visit. You may come in for a clinic visit and you're having a conversation and you tell your provider, hey, I'm having these symptoms. Your provider during that visit can potentially put an ultrasound probe on your abdomen and see, hey, are your symptoms really associated or correlated with inflammation? Also, it is quite accurate in terms of, in comparison to our gold standard, which is endoscopy. Many studies have shown that intestinal bowel ultrasound findings or readings of inflammation correlate with endoscopic findings. No, it is a painless procedure. Patients may feel a little bit of pressure from the abdominal transducer on their abdomen, but it would only be a slight discomfort. Well, the great news is there is no preparation needed. There's no fasting or preparation. However, specific instructions may vary by clinician preferences. Intestinal ultrasound can take between 10 to 30 minutes, depending on the complexity of the evaluation. So during the procedure, the patient lies on an examination table, a standard examination table used in all clinic visits, and a gel is applied to the skin of the abdomen to allow the transducer to have better contact with the skin to capture images of the intestines and any surrounding structures. Another wonderful thing about intestinal ultrasound is that there are no risks or side effects to intestinal ultrasound. It does not involve any radiation and does not involve any sedation, so we can actually use intestinal ultrasound as frequently as needed to monitor a patient's therapy or a patient's condition. The frequency of intestinal bowel ultrasound is determined by the gastroenterologist and the patient's condition, the complexity of their disease, their symptoms, and any treatment plan modifications.